Pavlik harness and abduction splinting bracing technique. Positioning: anterior straps flex the hips to 90 to 100 degrees flexion and prevent extension. Posterior straps prevent adduction of the hips. Confirm position with ultrasound or radiograph and monitor every 4 to 6 weeks. Worn for 23 hours a day for at least 6 weeks or until hip is stable. Wean out of harness over 6 to 8 weeks after hip has stabilized until normal anatomy develops. Discontinue hip if hip is not reduced by 3 to 4 weeks to prevent Pavlik disease. Complications specific to this treatment: avian due to impingement of the posterior superior retinacular branch of the medial femoral circumflex artery, seen with extreme abduction less than 60 degrees. Prevent via placement of abduction within safe zone located between the angle of maximal passive hip abduction and the angle of hip abduction at which the femoral heads displace from the acetabulum when the hips are in 90 degrees of flexion. Transient femoral nerve palsy seen with hyperflexion. Pavlik disease: erosion of the pelvis superior to the acetabulum and prevention of the development of the posterior wall of the acetabulum due to prolonged positioning of hip of dislocated hip in flexion and abduction. Important to discontinue the harness if the hip is not reduced by 3 to 4 weeks. Outcomes: overall success rate is of 90%, dependent upon age at initiation of treatment and time spent in the harness. Abandon Pavlik harness treatment if not successful after 3 to 4 weeks. If Pavlik harness fails, consider converting to semi-rigid abduction brace with weekly ultrasounds for an addition 3 to 4 weeks before considering further intervention.